So anyway, I worked for Sanofi Genzyme for about 17 years. I retired and I am now currently working with Diplomat as a Diplomat rare disease consultant. So anyway, I just want you to know what our services are in case you didn't know what a home infusion company can do for you. Next slide, please. So just as a little bit of a disclaimer, this is not medical information. This is just education awareness. Next slide. What I thought I would do is just give you the contact information for myself. So if there's any questions that you may have after the presentation or after this meeting, by all means, please give me a call. I've also included the Diplomat Specialty Infusion Group contact information as well, but I would love to talk with you if you're interested. Next slide. So Diplomat has personalized infusion support for ERT. Specifically, for this meeting, it's going to be for Fabry and Fabry disease. Diplomat has support for patients and families, and that includes community outreach and education, parent mentors. So if you're interested as a parent, or even for instance, as even just a patient, we can connect you with other people who have utilized our services to see how it works. Also, we provide in-services for school and daycares, and Diplomat has healthy living programs from specialized clinicians, also consultations with licensed clinical social workers. But one of the things that I want you to know is that our infusion nurses are experienced and trained in ERT. And they work with the adults, but importantly, the pediatric population as well. So on your first infusion, what would happen is we would talk with you and do a personalized risk screening to know what we need to know to make sure that you have a pleasant experience with your first home infusion, as well as the additional home infusions too. But this is something that you and your healthcare provider will talk about to see if it's something that's right for you. Also, it's important to know that we have stringent side effect management protocols and lot tracking and recall notification systems. But one of the things that, you know, as a summary is we have experienced infusion support for you for the home infusion of ERT, as well as single point of contact for all of your needs. So you have one phone number to get your drug, your supplies, as well as your nurse. And it makes it very convenient for patients, as well as the case managers and even the healthcare providers, to know that there's one number for to get all of your supplies and whatnot. You have a dedicated LSD customer service team. And just know that there is disease and ERT education with 24/7 on-call support. Next slide. So is home infusion right for you? It can be more convenient. In your home, there's no travel, it's private, and we ship supplies and deploy nurses in all 50 states. So if you're a snowbird, you shouldn't have any reservation in regards to this, as well as people who are in rural areas or hard to get to areas, or somebody who's 2 to 3 hours away from their infusion site. This may be something that's right for you. If you should have mobility limitations, that's not an issue because you're in your home. No wait because you are the only patient, which makes it less stressful and hopefully less potential exposure to germs versus home-based infusion center. Next slide. It can save time and money. So if you have multiple family members, they can be infused together. This is something to think about as too. It's a possibility of infusions at school, whether it's elementary or college age. Just know that if your school will allow it, we are open to exploring that with you. So anyway, there's no travel for the busy and overwhelmed. And we work with you to find the best schedule. And In a nutshell, it saves on travel and childcare costs. Next slide. So in regards to insurance, Diplomat is contracted with hundreds of healthcare plans, large and small. And just know we can help to assist with navigating the plan changes. And a great example is it's the Fabry patients who are transitioning off their parents' insurance plan. Just know that we want to help you and guide you through that if we can, from a home infusion perspective, as well as trying to maximize medical and pharmacy benefits, medical plan benefits. And just know this is an important situation too, is with Medicare Part D. It's a potential pathway to home infusion. A lot of people don't know that, but I think it's something to think about, especially as the weather gets bad or you just are not, you know, COVID-19 or whatever the case may be in regards to, you know, your medical plan. But just know life changes, such as a student with needs at school or college, we are there to help you out. Next slide. So one of the things that is important too is we have one-on-one insurance support. There's benefits investigation, prior authorization, and also appeals and coverage exceptions assistance. And I think most of you all know that it takes a village to sometimes get the insurance approvals. And just know another piece of that is the approval for the home insurance part of it. And we are there to help, and we are also a part of your team, whether it's with your healthcare provider or your Sanofi Genzyme case manager. We're also there with them to help with the home infusion piece of this if this is something that you want to explore. Next slide. Thank you very much. So if you have any questions, by all means, please ask me now, or we can do it later.
Thanks, Tanya. Are you going to be in the chat room suite for this evening?
We don't have one.
Oh, you don't have one?
No. And so this is the other part I want to let you know. We want to be a part of the resource of the NFDF website. Mm-hmm. So just know that we are going to be a part of that. So, you know, I wonder if I should back that up so people can see the contact information. So there's my cell phone as well as my email. And by all means, if this is something you want to consider, we can help you with that.
I appreciate that. You know,
no problem.
Home infusion takes that whole village you were talking about with the insurance approval too sometimes, but sometimes it can be a really great option for people. So it's nice there's somebody who's focusing on that for rare diseases. So let's see, what questions do you guys have for Tanya about Diplomat, about infusions? I particularly like, Tanya, when you mentioned that there's been some luck getting Medicare home infusions. That is a trouble for us as well. And I know it doesn't always work for everybody, but it's nice to at least explore that option when you can.
It doesn't include everybody, but it's something that we're finding that we're doing more and more and more authorizations for those. So if it's something you want to think about, please let us know. It's a very convenient situation.
Mm-hmm. All right, well, thank you, Tanya. Oh, look, there's a question here. We'd like to know if there's specific time frames for infusions, home infusions. Would it be 8 to 5, Monday through Friday?
You know, that's a great question because we've literally done these even on the weekends. There's even some infusion nurses that like just doing the weekends. So you just never know. I think the one thing that I also would like to stress, if you know that there's going to be a life change or you know that there's going to be an insurance change, please let your case managers know ASAP, mm-hmm. because sometimes it can take weeks to months to make sure that it's approved and you don't want to have an interruption in therapy.
Very true. Thank you. And then Christine asked, is this for U.S. residents only?
Yes.
Yeah. But I know there's other home infusion options outside of the U.S. So I think it's mainly talking to your doctor about what the options are. And in fact, some places like the Netherlands, you home infuse because you're self-infusing. So different countries. So, all right, guys. Well, thank you for that. Tanya, your secret session word is home, H-O-M-E.
So good deal.
Yeah,
Thank
everybody
you.
who would like to enter in the drawing, if you could put home and your name in the comments, we'll go through and do our drawing.